Hi, the population I'm going to talk about is prescription drug misuse and abuse. Prescription drug is the most commonly misused and abused substance, and a lot of people think heroin or other drugs that we talk about that are not good is number one, but actually prescription drug is the most commonly misused or abused substance, which is quite interesting. Mainly the causes are either pain relievers or psychological usage like benzodiazepines for anxiety and things like that. And so those are mainly used. Those are the ones. Opioids and benzodiazepines are kind of like the main drugs that we will be talking about, but other drugs that are prescribed will be included as well. It's interesting because pharmaceutical research and manufacturers for America, they're the ones who are involved in preventing these things from happening, and we will talk more about them. And it is a bigger challenge that we're facing right now in a public health, that we're trying to figure out how to reduce these numbers. If you look, everyone kind of knows that Utah is one of the many states that are using substance abuse, mainly due to prescription pain medications. And so if you look at the number, it's 73.1%. That's pretty big. Locally, I just chose southeastern Utah because that was the highest place for some reason. That was the highest, and maybe it's the location, maybe, but it seemed like almost all over the place had the similar number of percentage in Utah, with the problem of the substance abuse and primarily the prescription drug. Nationally, 75% of death due to opioids and 30% due to benzodiazepines, which are still very high. And it is showing that it is a big problem. And internationally, according to the World Drug Report, does say that 76% of deaths were due to those prescription drugs, but more specifically to opioids and benzodiazepines. Some of the contributing factors, this was quite interesting. An article showed that 70% of unemployed people is substance abuser. There's a typo there. But 9% of full-time workers also have a substance abuse. But then you can see kind of a gap there. You can tell that mainly unemployed people versus full-time workers is that because they're unemployed, most of the time they probably won't have these good insurance or even any insurance in order to go to the hospital, and they probably end up with diagnosis where they have to be hospitalized in acute care or whatever it is, depending on the person. And the main problem is they will have more chance to meet these drugs, where at the end they will be prescribed to have it for their pain management or whatever management it is. So they will be in touch for more of those things, whereas the full-time workers will have insurance to be able to take care of their health and be able to avoid bigger problems where they would have to end up where they have to use opioids or depression or anything else for the benzodiazepines and things like that. So that was very interesting article that kind of contributed in regards to social determinants of health. Now, there's some specific concerns because a lot of there are a lot of education going on. We can even see a big sign about drug abuse, prescription drug abuse specific to opioids, even on I-15 or anywhere else. But there aren't a lot about much development or evaluation of treatments when prescription drug dependencies, so if they get addicted, or other common comorbidities because they have chronic pain, depression, and other diagnoses that they have to use, those things aren't really advancing, whereas they're doing a lot of prevention work, but they're not really into a lot of treatments, or what do we do if this happened. And so that was an interesting concern that a lot of research was having, is now what after, if they've missed that prevention part of it, what do we do? And interestingly, even though that those higher percentage that we talked about, it's still not an officially high enough for the whole world to be concerned about it, because there are other problems that are going on, but like it says, it's not up to the pandemic levels across the world that we should be talking about, but it's not really being considered as a topic. Root causes are mainly not taking the prescribed meds as instructed, because either lack of discharge education or whatever the reason is, they could be prolonging the consumption even though they don't need it. It could be intentional, or they maybe have the pain still and they still need to use it, or the wrong dose, meaning they can possibly, most of the time, will be overdosing these drugs, intentional or non-intentionally, depending on the situation. And another root cause is that when the patient comes into the hospital, if they do have adequate pain, if they have a significant pain, we still need to use these drugs to manage their pain, and they have that right to request it. But where is that fine line where we need to prevent further complications that we were talking about, from misuse and abuse, but then able to provide adequate pain management? So it's that fine line of root causes that eventually leads them to have that misuse and abuse, because at the end, if they need it, the doctors won't say no, and it's been prescribed and they have the drug. So it's interesting and hard to figure that problem out. So I put met as depends on the situation and severity. The reason is because depending on the person, this can change drastically. A lot of times we're saying hypothetically this can happen, and that can happen, but eventually it will affect it if the severity does go up. So I'll just go through what I mean. So physiological needs are very necessary part of the Maslow's hierarchy, and this can drastically change depending on the support system. So if the person decides to continue prescription drug misuse and abuse, either due to intentional or unintentional, the support people, like their family or their friends, might not be able to support them. And for instance, this is hypothetical, the family might kick them out. And if they are in the situation where they're not full-time worker, or in the situation they cannot pay rent, then they may suffer from hunger, not having water, or not even have a home to stay. And so that's a very extreme situation. So I like to say it's both. It could be met and a met. And then security-wise, we're more talking about the safety in this situation, where if you're prolonging that taking prescription meds, and if it's out and you still need it due to addiction or things like that, you will be surrounded with, you might choose actions that are not definitely safe and against the law. So things like that. Love and belonging, again, it's the family support and things like that. And then kind of similar to self-esteem or other esteem, that can definitely go down because you're just not yourself. And then self-actualization, it's about that morality, all those things, because you can't even do the physiological part or the safety. That's gonna basically not be fully met, because not even those things are met. So some of the anticipated functional level is that if you're up to the addiction, which mainly causes it, or even overdose and death, then it will drastically change that status, because either you're dead or you're addicted and you cannot be yourself. Likely health outcomes, I said, like dependency, psychological changes like anxiety, things like that, and addiction. So this part was kind of awkward because my population won't be really dealing communicable disease or infection, or non-communicable, and both communicable and non-communicable. But if they do overdose, I mean, they can hurt their organs, and they're more susceptible to have disease like renal failure or anything like that. But it's not necessarily communicable, and prescription drug abuse can often lead to addiction, which they will use another types of drug. The second most common, it could be heroin, and if they're using the needles, reusing it, things like that, that possibly could cause infection and communicable disease. But that's more hypothetical, and mine just mainly focuses on prescription drug. So I just included it, but it's not necessarily directly linked to my population. Self-care and self-harm. This is the biggest thing. I mean, it's really hard, because some people may be using it unintentionally and some may be intentional, and that's very that can vary why it's happening. But it will definitely self-harm due to the potency of addiction of opioids, for instance, or even benzodiazepines, and overdosing it, again, it's not going to help them health-wise. Sometimes it can lead up to suicidal ideation when they cannot get those drugs and meet their needs. And so there can be a lot of problems with that. Risk for harm by to others. This is another thing that can be hypothetical. If you overdose and sometimes you have that extreme psychological side effect, maybe like delusional, things like that, maybe they might affect the other person to harm. But mostly if they're up to the addiction, they do have risk for harm by others, maybe when they're going to the unsafe place to get other drugs. But also, this isn't really related to prescription drugs, but I wanted to kind of mention that is a possibility. So here's the references. I hope that made sense. I really enjoy finding out all these things about the prescription drug misuse and abuse. Thank you.